Good morning. Today we will discuss the difference between SDP and RDP. We know that platelet transfusion is very common and life-saving intervention in hematology, oncology, and critical care medicine. The two commonly used platelet products are SDP and RDP. Let's understand their difference, clinical relevance, and indications. The sources. At first, the source of platelet differs in SDP and RDP. SDP is obtained from single donor using the method called apheresis, but RDP is preferred by pulling platelets from multiple whole blood donor. This single donor source makes SDP immunologically more safer. The platelet yields. Now let's talk about platelet. SDP increase platelet by 30,000 to 60,000 per cubic millimeter. On the other hand, RDP increase platelet count by only 5,000 to 10,000 per unit. Hence, SDP provides a much higher and predictable increment. Adult therapeutic dose. Only 1 unit SDP is sufficient, but 4 to 6 unit RDP is needed. So 1 unit SDP equals to multiple RDP. Expected platelet increment is higher in SDP and more predictable in SDP, but lower and variable in RDP. Risks of alloimmunization and TTI, that is transfusion transmitted infection, is low in SDP but higher risk in RDP due to multiple donors. Use in platelet refractionaries. SDP is preferred but RDP is not recommended. Self half-life is almost same, that is 5 days, but in both cases continuous agitation is needed. SDP is expensive, on the other hand RDP is cheaper. Indication: SDP is best used in repeated transfusion, high risk patient, that is hematological malignancy, bone marrow failure, platelet refractionaries, and transplant patients. But RDP is preferred in emergency situation, sometimes in dengue outbreak and resource limited settings. So, to summarize, SDP is safer, more effective, and predictable but more expensive. On the other hand, RDP is economical and useful in emergencies but less efficient. The choice depends on clinical conditions, urgency, and available resources. We usually termed SDP as apheretic platelet and RDP as platelet concentrate. This is all for today. Thank you. Thank you very much.